Hello everyone, I am Dr. Deepak Koli, working as a consultant anesthesiologist and head of oncology anesthesia services at Sir H.N. Reliance Foundation Hospital, Mumbai. Today I want to talk to you about a critical yet often overlooked aspect of cancer care, that is the role of anesthesiologist. When we think about surgery, especially for cancer, we often focus on the surgeon's skill or the effectiveness of the treatment. However, the anesthesiologist plays a vital role in ensuring that the entire process is safe and effective. Now, anesthesia is not just about putting patients to sleep. It's about managing their pain and also ensuring their safety throughout the surgical experience. For cancer patients, this is especially crucial because their bodies are already under significant stress from the disease and its treatment like chemotherapy. Oncoanesthesia is a specialized field that basically focuses on providing safe anesthesia for cancer patients undergoing surgery. It is all about ensuring that patients receive the best care during their surgical journey, particularly for complex procedures like abdominal and cytoreductive surgeries. Now, cancer surgeries can be challenging and may significantly impact a patient's recovery and long-term outcomes. Oncoanesthesia plays a vital role by minimizing the stress by using tailored anesthesia technique as per the patient's condition so as to reduce the stress on your body during the surgery. Secondly, enhancing the recovery by giving effective pain management, which leads to quicker and smoother recovery. A smooth recovery will then allow for a timely oncological treatment, which is crucial for the better outcomes. Now, what are the key strategies in oncoanesthesia? The foremost is the prehabilitation, which is a proactive approach designed to enhance the physical and mental well-being of cancer patients before the surgery, so that cancer patients are physically and mentally ready for the surgery. Now, it includes physical exercise, where a tailored exercise program is given to the patient so as to improve their cardiovascular fitness and muscle strength, which are very crucial for enduring the stresses of the surgery. Now, it is often observed that patients who engage in the prehabilitation, they experience a better post-operative outcomes. The second important factor is the nutritional support, because the proper nutrition will help you boost your energy levels and it will help in healing and ensuring the patients are in optimal health before the surgery. Now, addressing mental health, which is also important through the psychological support, because it will help the patient cope with the emotional challenges of the cancer diagnosis and the surgery, which will reduce their anxiety and overall improve their resilience. So, what are the benefits of rehabilitation? First, it improves your functional capacity. There is a reduced length of hospital stay and also the better quality of the life. So, by focusing holistic health, physical, nutritional and psychological aspects, rehabilitation improves the overall quality of life for cancer patients during their treatment journey. We also opt for the multimodal analgesia. So we use a combination of pain relief methods for all our patients. So we include a regional anesthesia, and along with that we also use non-opioid medication, which can minimize the discomfort and reduce opioid use, lowering the risk of complications. The third important factor is fluid management during the surgery, because it is critical to prevent complications like fluid overload, which can lead to the abdominal and respiratory issues during the recovery. Also, continuous monitoring throughout the surgery is very much necessary. So we keep a close eye on patient, which allows us for prompt addressing of any issues or any complication happening during the surgery, so as to ensure a smooth recovery process. Now I will talk briefly about cytoreductive surgery. So what is cytoreductive surgery? Basically, it is a surgical procedure which aims to remove as much of tumor as possible, especially in cases where tumor is too large to be completely removed. So now we can imagine that the tumor is a big weed in your garden, and the surgeon will try to pull out as much of the weed as they can, including the roots, so as to prevent it from growing back. Now, goal is to reduce the size of the tumor. How it will help? It helps in slowing down the tumor growth. It also makes chemotherapy more effective and relieve symptoms like pain or blockages. Now we can think of it as like pruning a big bush. You can't always remove the entire bush, but by cutting it back, you can control its growth and make it more manageable. So this surgery is often used for the cancers that have spread to the abdominal cavity, like a ovarian carcinoma or a colon cancer. It is a complex procedure, but it can be an important step in treating these type of cancers. Now during surgery, anesthesiologists, we monitor and manage many things to keep the patient safe. We watch the patient's blood pressure, breathing, also the fluid levels very closely. These surgeries usually cause a lot of fluid to shift around in the body, and the patient's temperature also change a lot too. Also at the same time, the chemotherapy drugs which are used, they cause problems with the kidneys and electrolyte imbalances. So we use advanced monitoring techniques to make sure that the patient's organs are getting enough blood flow and also to keep their blood pressure stable. Now after surgery also we continue to closely monitor the patient in the intensive care unit. We watch for the complications like bleeding problems or infections or issues with the patient bowels. We also help the patient start eating as soon as possible to help them recover faster. Overall, the anesthesiologist's job is critical in keeping patients safe and help them recover well throughout the entire surgical process. Now, cytoreductive surgeries are usually followed by hyperthermic intraperitoneal chemotherapy to target the remaining cancer cell. So now, as the name suggests, it is a hyperthermic intraperitoneal chemotherapy. So basically, we give a special type of chemotherapy agent that is delivered directly into the abdominal cavity during the surgery. So you can imagine a warm bath that is being infused with a powerful medicine. So basically, surgeon will remove as much of the tumor as possible, and then a warm solution containing a chemo agent is pumped into the abdominal cavity around the temperature of 106 degrees Fahrenheit. The solution is then left in an hour, allow it to penetrate and kill any remaining cancer cells. At the end of this an hour, solution is then drained out of the cavity. So treatment is like a chemotherapy wash that targets any remaining cancer cells in the abdominal cavity after your cytoreductive surgery is done. So by delivering the chemotherapy directly to the affected area, it can be more effective than traditional chemotherapy which is given through a vein. So think of HIPEC like a targeted attack on cancer cell using heat and medicine to destroy them. To summarize, as cancer rates continue to rise, the demand for effective anesthesia in oncology will only increase. So it is essential that we recognize the importance of anesthesiologists in the surgical process and advocate for specialized training in onco-anesthesiology. This will ensure that cancer patients receive the best possible care during the surgical journey. In conclusion, the role of anesthesia in cancer surgery is not just supportive, it is foundational to the success of the treatment. By understanding and appreciating this, we can help improve outcomes for the countless patients facing the challenges of cancer. Thank you for your attention, and let's continue to spread awareness about the importance of anesthesia in cancer care. Thank you.